And now it's time for the sponsor perspective portion of our program. Please welcome NBC4 Washington anchor and National Kidney Foundation board member Jumi Olabanji. She is moderating a conversation with Nicole Jefferson, a kidney transplant patient and advocate, and Dr. Holly Kramer, immediate past president of the National Kidney Foundation and professor of public health sciences and medicine at Loyola University. Over to you, Jumi.
Hello, everyone, and we want to welcome you to this amazing chat we are about to have. My name is Jumi Olabanji. I am an anchor at NBC4 in Washington and also a board member for the National Kidney Foundation, the region serving the National Capital Area. And we want to thank you for joining us for this conversation. I am joined today by Dr. Holly Kramer, the immediate past president of the National Kidney Foundation. And we are also joined by Nicole Jefferson, who is a kidney transplant patient, and she's an advocate, and she is joining us from Dallas, Texas. Kidney disease is growing in the United States. 1 in 3 adults are at risk for developing this very serious illness. The pace of funding, research, and innovation in therapies to try to tackle and combat kidney disease lags far behind the research in some other diseases that we see in this country. But the National Kidney Foundation has mapped out a great strategy to help accelerate the pace of discoveries and care, especially in cases made worse by healthcare inequities. The report that we're going to talk about today calls on Congress to fully fund research, implementation science, and also other priorities in the fight against kidney disease. If we can start with you first, Dr. Kramer, can you tell me a little bit more about the burden of kidney disease and why the National Kidney Foundation really felt like it was important to develop this roadmap, if you will?
So the National Kidney Foundation has strongly felt for a long time that lack of research investment is one of the main reasons why we have stagnation in the delivery of care, stagnation in the diagnosis of kidney disease, and stagnation in the development of new treatments for kidney disease. And so now it's incredibly expensive disease. And in order to reduce healthcare costs, reduce health disparities, and decrease mortality, we need to invest in kidney disease research now.
Yeah. Thank you so much for that. And you talk about those patients and those numbers. I want to bring Nicole into the conversation right now. Nicole, I know that you are a transplant patient and recipient, but you kind of got into this with no underlying conditions. Can you tell us a little bit about your individual story?
It was late one night when I actually went to the emergency room around 3 o'clock in the morning. And when I was in there, I thought I was just in there for this flu to go away. And my sister was there with me, and so was my mother. And my sister, when they came in, the doctor said, "Why didn't you tell us you had kidney problems?" And I said, "I don't have kidney problems." And he said, "You do have kidney problems." And he left the room, and my sister said, "Oh, it's probably kidney stones. You'll be fine." And then when he came back, he said, "No, you have severe kidney problems." And jokingly, I said, "Dialysis type kidney problems?" And he said, "Yes, dialysis. You'll be starting dialysis immediately." And so at that time of my life, I was in my early 30s. I had a young daughter who was very active. So I didn't know how I was going to manage going on with her events and her sports and how I was just going to continue to live and work. So that was the big shock for me.
Yeah. Dr. Kramer, it doesn't sound much like things have changed for patients when it comes to treatment and dialysis in the past 4 decades.
One of the main reasons why we lack innovation in kidney disease treatments is lack of research investment. And so if you look across the board for multiple medical specialties like cardiology, cancer, digestive diseases, kidney disease is at the very bottom consistently. We have the least number of clinical trials. We have the least number of epidemiologic studies. We have the least amount of corporate investment in research. And that has led to just a stagnation in the treatment of kidney disease at all stages.
So, Nicole, I wanted to ask you a question about what it was like working when you were on dialysis. The numbers show that only 1 in 5 people stay in the workforce while undergoing dialysis because the majority cannot work. Can you tell us a little bit about what your experience was like with your employment when you were undergoing dialysis?
Dialysis is very draining, and a lot of people are not able to work. However, at my job, I had a supervisor who would allow me to lie under my desk whenever I felt like I was too tired or just worn out. And so typically that would happen the day after dialysis. And luckily I had that and he was able to do that because I was upfront and shared with him everything that I was going through.
Wow. And so, Dr. Kramer, how has this new research, this new roadmap, if you will, from the National Kidney Foundation, how do you think that it'll improve the quality of life for kidney patients like Nicole, who are active, have families, have young children, are working and trying to balance all of this and their disease at the same time?
Well, the National Kidney Foundation convened what we call a research roundtable workforce. So we included people who are across the nation doing research in both preclinical sciences and in clinical sciences, and people who have expertise in a broad range of research areas. And so we have identified the areas where we think that investment and research can really move the treatments forward, can lead to better lives within a short period of time if we invest in those areas. And so we also included patients and caregivers, transplant recipients, so that all of these voices could be used to determine where are the areas that we should invest in research. And so we have an areas of preclinical science that if we invest in that area, we can develop new treatments and we can develop new ways of diagnosing patients, and we can get more personalized medicine, and all the way to the clinical science area, where if we elaborate and develop more clinical trials and we diversify the patient population that is in those clinical trials and we invest in implementation science, we really think we can move the needle and decrease mortality and keep people off dialysis and reduce medical care costs.
Why do you believe maybe that clinical trials for kidney disease are still lagging behind some of the other diseases that we see out there, heart disease, cancer, and some of the others?
So if you look back in the 1970s, the early 1970s, we really weren't sure about how to treat hypertension and who to screen. And it was the clinical trials that were done that showed that treating and screening high blood pressure improves mortality. And so Congress actually invested over $150 million alone just for an educational component to educate the community and educate primary care physicians and other physicians how to diagnose hypertension and how to treat it. And that led, just within the first few years after that was implemented, a 3% decline in stroke mortality. And over the past 15 years, there's been over an 800% decline in the number of years lost to death or disability from heart disease, while in the same time period, mortality for kidney disease has increased. And so that research investment and that education investment will save lives, but it really takes, a combined effort to increase research and increase awareness of kidney disease so that cases like what Ms. Jefferson went through, which is actually really common among people who have kidney disease, to no longer occur.
More diagnosis, if we can find out earlier. Even looking at my situation, although I ended up in the emergency room, I had just gone to my primary care physician a week prior to that. And there were no testing run because there was nothing for them to look for. They didn't think it was high blood pressure. They didn't think I didn't have diabetes. I didn't have anything that would trigger them.
I mean, if you're getting your first treatment in an emergency room, that's incredibly costly. And so if we talk about cost, that's another reason why we should invest in kidney disease research, because we know that 1 in every $5 on Medicare fee-for-service expenditures is spent on someone who has kidney disease, but only 1 in every $50 for the NIH research investment is spent on kidney disease. So there's a tenfold disparity in what we're spending on kidney disease versus what we're spending on research to prevent kidney disease and prevent people like Ms. Jefferson getting her first treatment for kidney disease in an emergency room.
Yeah, I have to imagine that is costly. Dr. Kramer, can you talk a little bit about the disparities and the inequities when we're talking about kidney disease? Because, the numbers show this is impacting Black and Brown communities at higher rates. Can you talk a little bit about that?
So one of the things that we talk about in our research roundtable is that we want clinical trials to include underrepresented groups so that we can get information that will improve outcomes for underrepresented groups and keep them from developing kidney failure. So if you look at the dialysis population, over 1/3 are African Americans, versus if you look at the general US population, it's 13%. So that's a threefold difference in the representation of African Americans in an end-stage renal disease group versus the total US population. And if you look at Hispanics, people who have Hispanic ethnicity are about 1.5-fold more likely to progress from kidney disease to kidney failure. So we need research to determine how to reduce those health disparities and provide more equitable health care and prevent people from ending up on dialysis.
Dr. Kramer, one of the reasons we're here virtually together is because obviously we're still in the midst of this global pandemic with COVID-19. Can you kind of touch on, briefly how COVID has also affected the same group of underrepresented, I should say, communities, and how did it impact the patients you're seeing who are specifically kidney disease patients?
I think it's really important to remember that the very first reported death due to COVID-19 was a dialysis patient in the state of Washington. Mm-hmm. That's how important COVID-19 has been for people with kidney disease. If you have advanced kidney disease, you have an almost fourfold higher likelihood of going into the hospital or dying because of COVID-19. And we also know that vaccines may not be as effective in people who have kidney failure, or if you're taking immunosuppressive medications to keep a kidney transplant.
What can patients like yourself do, and other patients who may be listening to this conversation, what can they do to help our lawmakers and policymakers kind of understand the importance of investing money and research and time into kidney disease research?
One of the things that I have noticed is when I do reach out to Congress, oftentimes they may not have a direct connection to kidney disease. But then I ask, does a family member have high blood pressure? Does a family member have diabetes? And then they all have someone in their family who has one of those conditions. And that's when I explain that those are the number 1 and 2 causes of kidney failure. And then, of course, at that time, things perk up and they understand it a little bit better. And to know that if they have family members who have these conditions, they may very well end up with kidney failure or kidney disease. So for patients, I just suggest making sure you're writing the Congress people, also making sure that when you see them in public in your cities, make sure you go up and speak to them and tell them about your kidney disease. Even if they don't have time to hear your story, just let them know. And if there's a bill or anything, I always try to have those numbers available and call out the bills that I want them to sign or try to co-sponsor. That's what I have for other advocates.
Great information, great information. And Dr. Kramer, lawmakers who may be listening in and part of this day or this discussion, what would you like them to know about what they can do to help kidney patients just like Nicole?
Invest in kidney disease research. So we need more funding for kidney disease. We have lagged behind all of the other medical specialties regarding corporate investment combined with NIH investment. And really the time is now. If we invest in kidney disease research, we can reduce mortality, we can reduce health disparities, and we can reduce health expenditures. It's a win-win.
Dr. Holly Kramer, Nicole Jefferson, thank you both so much for being a part of this very important discussion.